Hello. Today I'm going to talk with you about preventing health issues with your Pomeranian. This is for anyone who owns a small Pomeranian or is interested in adopting one that wants to learn more about the risks this small breed faces and how to soften those risks. Bit of history with the Pomeranians. They were formerly known as the wolf dog. They didn't gain popularity in England until the 18th century, where members of the English monarchy developed an interest in the breed. In 1761, Queen Charlotte married King George III and brought her pet dogs to England. The Pomeranian is called after the German area Pomerania, from where Queen Charlotte imported her Pomeranians. Some characteristics: they are 8 to 11 inches, weighing in at 3 to 7 pounds, and they vary in color. They're double fur coated. The top coat consists of long guarded hairs, while their undercoat is shorter, soft hairs that provides insulation in the wintertime. Their high plump tail sets them apart from all other dogs. And because they are double coated, they require regular brushing and bathing. They live about 12 to 16 years on average. To help your Pomeranian enjoy a loving, careful, and fun-filled life, now is the time to learn more about the ways to limit or eliminate the risks that this little breed confronts. In my experience, I could have done a backflip when I received permission from my landlord to get a small puppy. When I found a Pomeranian, I soon fell in love with her and adopted her. Luna has just become one with the family. However, I wish I would have known about the risk beforehand, so we were prepared. We took her out one night to use the bathroom. As she was running around, she began to whine loudly. We carried her inside and discovered she was also limping. A few moments went by, she was fine, no whining, no limping. The vet was able to see her the next day and confirm she's okay, but let us know that in small breeds, particularly Pomeranians, they suffer from a problem known as luxating patella, and that is where the kneecap dislocates or moves out of its normal position. Most of the time the dog can put it back in place on its own, and that's what Luna did. She just took over, did her thing, and that's why she was fine moments later. Since then, we have been extra careful with her, but I like to think of it she was made for our family because I have myself have knee problems. I adore all breeds of dogs, but I've always preferred the little breeds. I'm 4'11", and a bigger dog will just overpower me. I grew up with miniature Chihuahuas. They were more of my great-grandmother's dogs, but I did help take care of them. But just always being around smaller pups, I was more prone to the small breeds. Now today I'm going to talk to you about treatments that can reduce or eliminate the issues Pomeranians face. I'm going to do so by focusing on the luxating patella, collapsed trachea, and black skin disease, also alopecia X. The luxating patella. As I stated in my experience, this condition is common in small breeds where the kneecap comes out. It can happen in both knees, usually 4 to 6 months, but can happen throughout their lifespan. Now, there are different grades. Grade 1 is manually slipping the kneecap out of its socket with your hand. It easily comes out. The moment you release it, the kneecap goes right back into its natural position. Grade 2 is spontaneously comes out when bending the knee. The patella remains luxated until it's manually repositioned or when the Pomeranian extends their joint. Grade 3 is when the Pomeranian is bending and extending their kneecap will constantly slip in and out of its socket. And grade 4 is where it's permanently luxated and cannot be manually repositioned. Some causes for this are genetics passed down from the mom or the dad, and if it's not genetic, most likely a birth defect. Or it could be some types of trauma, jumping, playing around too hard that causes it. Some treatments or preventions: if it is severe enough, it will have to have surgery. Small Pomeranians can easily be stepped on, so be careful when you're around your Pomeranian. And certain supplements that target bones, hip joints, and knees can be quite effective. And it's best to always have a knee wrap at hand. Now that you have knowledge on luxating patella, now it's time to talk about the most serious condition, the collapsed trachea. This condition occurs when the cartilage rings around the trachea weaken and collapse inwards from top to bottom, obstructing the windpipe and leading to coughing. This usually occurs in middle-aged and older dogs, but can also be seen in certain toy breeds. It's a progressive condition, meaning it gets worse over time. Genes likely play a role in the dog's developing collapsed trachea. There's no cure. It can be fatal. A few ways to prevent collapsed trachea is to manage your pup's weight, cough suppressants, anti-inflammatories, and harnesses. Instead of a collar, use a harness. This avoids putting pressure on the throat. Reduce exposure to airway irritants like smoke, wildfire smoke, fragrances, air fresheners. Avoid hot and humid environments, and limit dust and allergens in their environment. Now this is Luna, and as you can see, we do have a harness on her. It doesn't have to be anything fancy, just as long as there's not restriction around the neck area. It's very loose, and it provides comfort for her. Alopecia X is a skin condition where the dog loses its hair, often in patches, and it also might darken. The pup doesn't feel any itch or pain from it. It begins around the tail and back legs. The exact reason why Pomeranians get Alopecia X isn't fully known, but it's believed to be related to hormonal or genetic factors. There is no exact cure, but there are treatments to manage the condition. Medicated shampoos or lotions can be prescribed to promote hair growth or improve skin health. Omega fatty acids and certain vitamins might help improve skin and coat health. Neutering or spaying the dog has led to hair regrowth, suggesting that a hormonal component to the condition. The condition can progress or change. Regular vet visits are essential to monitor the dog's skin and hair health and make any adjustments as necessary. To wrap things up, it's critical to consult a vet if your Pomeranian shows unusual behavior or appears to be in any pain. The sooner you notice something, the better off. Always keep an eye on your pup. We went over 3 main health issues, what they were, the causes, and treatments or preventions. From Queen Charlotte to present day, many people, including myself, adore Pomeranians because they are beautiful and fluffy pets. Making sure our furry pals are happy and healthy is part of taking care of them. The other part is showing them lots of love. Thank you.